From the Gulf States Newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm community engagement producer Nellie Beckett, chopping it up this week. Today, we're focusing on the opioid addiction crisis in Mississippi and how millions of dollars in opioid settlement funds are being used or not used. The settlement funds are the money from lawsuits against opioid manufacturers and distributors. In this year's legislative session, Mississippi lawmakers appropriated about $60 million from these funds for various purposes, some directed toward treating addiction and preventing drug abuse, but with a substantial portion used for other purposes. Mississippi is one of the last states to start spending its opioid settlement money, and the way those funds are distributed continues to raise concerns for both advocates and lawmakers. To talk more about it, I'm joined by senior reporter Drew Hawkins, who's been covering opioid settlement funding in the region and been following the money in Mississippi. Hi, Drew.
Hi, Nellie.
So, it's been a journey. You and I have spent the last few months traveling all over Mississippi talking to people with lived experience of addiction, but you've been following this for even longer, so how did we get here? Walk us through it.
So I think a good place to start would be with the opioid crisis itself. Even though Mississippi is small in terms of population, the opioid crisis has been a serious problem in the state, especially along the coast and in places like Jackson and Hattiesburg. Since 2000, more than 800,000 Americans, including more than 10,000 Mississippians, have died from opioid overdoses.
Right. And one of the things you've been reporting on is the impact of the opioid crisis on children and families. Can you talk a little bit about that?
Yeah, so really, children and families are really the hidden victims behind this crisis, right? The opioid crisis impacts more than just people who struggle with addiction. It really ripples out into families and communities. And I think a good example of this is a woman named Allison Koenig that I spoke with at the Fairland Center in Dublin, Mississippi. It's one of only 2 treatment facilities in the state that accepts pregnant women and women with young children.
I was addicted to heroin. My husband was addicted to heroin, and I found him dead from an overdose.
So Koenig's husband, Wiley Koenig, died on Mother's Day in 2020. And she and her mother-in-law tried their best to revive him, but they couldn't bring him back.
And then I look over and I see my children watching it too, So it's very, very traumatic. And it's been 6 years and I'm just now really dealing with it in here.
After her husband died, Koenig's own addiction got worse. And she's in treatment now, but you've got a family here where the mom is struggling with addiction, the father died from an overdose, and the grandparents are having to help care for the young children. So this is a situation that's actually not uncommon.
And this was work supported by a data reporting fellowship with USC's Annenberg Center for Health Journalism. So I know you dug into a lot of data. What did you find?
Yeah, I actually went through a lot of different data sources related to health, foster care, addiction, and family structures. And what I found is parental substance use is a major reason why Mississippi leads the nation in infant and maternal mortality and has the highest foster care rate in the Gulf South. More than 40% of those children enter the system because of parental substance use, and fewer than half are reunited with their parents. Many others end up with grandparents. Mississippi has the highest rate in the country of children raised by a grandparent. And one of the biggest problems for people struggling with addiction in the state is access to treatment. We heard from Allison Koenig earlier, who was able to get into one of those 2 treatment programs for pregnant women and women with small children. And advocates say this just isn't enough for the scale of the opioid crisis. This is something I heard from Brenda Foster. She's lead nurse navigator for Mississippi State Department of Health's Opioid and Substance Use Disorder Program. And she says opioid settlement funds could help expand this access.
There are a lot of barriers. If we could just address those and do something with those with some of this money, that would be great.
Okay, so let's talk about the settlement money. Where is it coming from and where is it going in Mississippi?
Right. So the opioid crisis triggered a wave of lawsuits with opioid manufacturers, marketers, and distributors. And many people might be familiar with names like the Sackler family and Purdue Pharma. But there are a bunch of other companies and pharmacies, places like CVS and Walgreens. In those lawsuits, they resulted in settlements totaling more than $400 million for Mississippi. And that money is meant to help fight the opioid crisis and heal some of the damage caused by it.
Can you expand on that just a little more? Does that mean Mississippi is getting a check for $400 million?
No, not exactly. The funding comes in basically installments over the next 2 decades.
So, okay, how does it work? How do spending decisions about the money work?
So each state sort of has their own approach to how they structure, manage, and distribute the funding. And Mississippi took really a more unique approach. The Attorney General's office decided to split the money into basically 3 buckets, is a good way to think about it. 70% is controlled by the legislature, and it has to be spent on what's called abatement. Basically, it has to be spent on things related to addiction and the opioid crisis. 15% is also controlled by the legislature, and that can be spent on anything. It doesn't have any requirements or stipulations. The other 15% is distributed directly to cities and counties for them to spend it however they choose, on anything. The Attorney General did not put any requirements on how that money should be spent.
So, the big abatement bucket, 70%. What's been going on with that money?
Well, so far, none of that money has been spent yet. Mississippi is one of the last states to start spending that money. And last year, the legislature created what's called the Opioid Settlement Fund Advisory Council to review applications for funding and make recommendations to the state legislature. So over a period of about 8 months last year, the Advisory Council got together in Jackson to talk through how they wanted the process to look and how they wanted to review applications for funding. And they decided to rank them in a tier system with higher tiers given more priority.
Okay, that's interesting. So, what's the money been spent on so far?
So before this session, the only funding that's been spent, aside from a small amount for attorneys' fees, is the 15% that's gone to cities and counties. And remember, this money did not have any requirements. It could be spent on whatever they wanted to, right? And that spending has been slow and very loosely tracked. Most of it is actually still unspent, and a lot of it was folded into general budgets or spent on things unrelated to addiction, including buying police vehicles, guns, batteries, walkie-talkies. Less than 1% has gone toward addiction-related programs, and most of those are for mental health crisis response and drug courts. And in this session, we saw bills that would have changed this. They would have required this 15% bucket of money for cities and counties to be spent on things related to addiction. But ultimately, those bills either died or were changed to remove this requirement.
Okay, and what about the buckets controlled by the legislature? Walk us through that.
So in December, the Advisory Council submitted their recommendations to the legislature ahead of the session so lawmakers could use it as a sort of guide as they make decisions about appropriating that funding.
And how was that process with the council? Were there any issues with their approach?
Yeah, there were concerns raised about how the council operated. I mean, for starters, there were no members on the council with any real lived experience of addiction who could vote on funding applications. And this is something that advocates were concerned about. You know, people with lived experience can give insight into what it's actually like to struggle with addiction in Mississippi and what resources or programs might be good to invest in to help others that are still in addiction. And here's James Moore. He lost his son to a fentanyl overdose. So while he himself never used opioids, never suffered from opioid use disorder, he's been impacted by the crisis, and he was a member of the Advisory Council.
The voices that we heard through this opioid settlement council process were the voices of organizations that are in this business or that are in this as an avocation. We did not hear from the general public.
Moore also raised concerns about the Advisory Council's process, specifically the fact that many of the funding applications that were ranked in higher tiers came from organizations that had representatives on the council, so they could advocate for their own proposals because they were in those meetings, while the other organizations that submitted applications didn't have representation on the council. They weren't in the room while this was being talked about, so they couldn't answer questions, clarify, or talk about how their organization would use the funding if they got it. And during the session, a bill was passed to reform this process. It requires the Attorney General's office to hire an outside consultant to guide spending decisions, and it tightens conflict of interest rules for Advisory Council members, both of which are responses to concerns raised by recovery advocates. This is that bill I was talking about earlier that at one point included a provision that would have required local governments to spend their share on actual opioid prevention, and that was ultimately removed from the final bill that passed.
I want to touch more on the idea of people with lived experience of addiction. You said they didn't have any input into the advisory council's decision? Can you explain exactly what that is and why it's something you focused on with your reporting?
Yeah, so in addition to how the crisis is impacting children and families, I wanted to try to talk to people with lived experience about the settlement funding. What did they think would be good ways to spend it? So since January, Nellie, you were along for all of this. Our newsroom traveled more than 5,000 miles across Mississippi talking to people with actual lived experience of addiction. We went to Recovery Day at the Capitol in Jackson.
It's going to make me cry. I was spending every dime that I made.
A bike shop in Hattiesburg.
My mom's still in active addiction. My grandparents are still in active addiction.
A treatment center in Dublin.
It ripped me from my family and my children.
And an event in Biloxi to remember people who died from overdoses.
They were tired of burying their friends, and I'm sure they are.
And we collected more than 200 written responses about how they think Mississippi should spend the settlement funds. Most of them said treatment, many said support for families and children, others said housing, mental health care, transportation, and more than a third supported using the funding for harm reduction, tools like Narcan, fentanyl test strips, and safe spaces to prevent overdose deaths. Nobody we talked to said the money should go to law enforcement.
And can you talk about what we did with those responses?
I sure can, Nellie. We took them to the Capitol. On March 12th, the Gulf States Newsroom took all of those 200-plus written responses to the Mississippi State Capitol and displayed them for lawmakers making decisions about how the money gets spent. And we set up a listening station for them to hear these voices in their own words. And a few lawmakers stopped by, like Representative Jeffrey Hullum III, a Democrat who represents Gulfport and Harrison County. And I remember that he was listening intently with his eyes closed. And afterward, I asked him what he thought about the responses.
Nobody knows better about the opioid crisis and addiction than the ones who are afflicted by it and their family members. Their family members have to live with this. So we need to make sure this money is getting used in the right way. But we also need to make sure what's the follow-up, what's the results of this money after we get this money.
And Representative Bubba Carpenter, a Republican who represents Alcorn and Tishomingo counties, flipped through the binder of written responses that we'd brought while he listened to the voices. For him, he says the stories of parents losing children stuck with him.
I'm just thinking these folks need to be part of the legislative process to figure out ways what would be the best for them, because they're dealing with something that we may not ever know about.
Okay, so the funding controlled by the legislature, what did they ultimately decide to do with it this session?
All right, so let's get into it. At the end of the session, lawmakers voted to distribute nearly $60 million across the state, spread out across 7 different agency budgets. And of that, just over $50 million is restricted to addiction-related purposes, while about $9 million lawmakers gave themselves discretion to spend on anything, including $5 million for clinical trials of the psychedelic drug ibogaine, which some people believe may be useful for addiction treatment. The notable tension is how they made those decisions. The spending plan they passed only loosely follows those recommendations from the Advisory Council, and the amounts frequently differ from what the council suggested. And in some cases, lawmakers directed money to organizations the council never reviewed at all. One example is a $1 million workforce recovery program through the Department of Employment Security. That agency never even applied to the council. Another is a $500,000 allocation to a youth prevention group called Hope Squad. And with that group, there were basic questions like where is it based? How does it operate? That couldn't be answered. So the short answer is they moved money out of the door for the first time after years of sitting on this money, but they did it in a way that raised real questions about whether they followed the oversight process that they themselves created. But it's important to note that Mississippi Governor Tate Reeves actually vetoed a few of these appropriations, more than $1.5 million from the Attorney General's budget bill. In a statement, Reeves said he approved most of the roughly $30 million lawmakers directed through the bill, but he said 3 grants, including that $500,000 for Hope Squad that I mentioned, as well as $800,000 for the Gulf Coast Center for Nonviolence, and $250,000 for Finally First. They were not vetted through the Opioid Settlement Fund Advisory Council, and that's why he vetoed them. And Reeves did say that those groups can still apply during the council's 2026 grant cycle.
And how are the organizations reacting? Did you talk with any of them?
I did. I talked with Christina Dent. She's the founder of End It for Good, and the group had requested $209,000 to create programs for families of people that struggle with opioid addiction. The legislature appropriated $200,000, a little less than they asked for, but she said she's grateful for the funding, and here's what she said about it.
We want to help more families have a safe place to work through those things with other families going through similar challenges, and also with trained facilitators who can help continue to teach and model and work through those complex situations with the skills and tools that are taught in the curriculum.
She also said she'd like to see more oversight over the advisory council's process, which is echoing what James Moore said, right? And she said they also plan to apply again for future funding rounds. But a concern that she has is that small organizations like theirs, they're starting something new, and that takes time to get off the ground. Other organizations, like, for instance, a hospital system, they've been doing this work that they applied for funding for already for years. So it's easy for them to add that money to what they're already doing and then have data showing how it's helping, right? But with a new program, and especially with a smaller organization like End It for Good, they need time to build and have data that shows how the program is working. So she hopes new programs like what they're trying to do will get more funding and time to get their programs up and running.
Okay, and earlier you mentioned this money isn't coming in at once. You said lawmakers appropriated about $60 million this year. Some of it was vetoed, but the state is getting over $400 million. So this isn't the end of the opioid settlement funds. What can we expect to see going forward?
Yes, this is definitely not the end of the opioid settlement funds in Mississippi. And what we know is we will see the Advisory Council again receiving and reviewing funding applications and making recommendations. In future sessions, lawmakers will have those recommendations. They can use them to help make decisions about how they appropriate more of the funding. But like in this session, we can't know what decisions lawmakers ultimately end up making. The recommendations from the Advisory Council are just that, recommendations. In the end, the legislature can choose to follow them, ignore them, or like we saw in this session, direct the money wherever they see fit. But we saw bills that would change this, and the concerns raised during the process this last go-around might inform the process in the next go-round.
Senior reporter Drew Hawkins, thanks for joining me and talking about the work we've been doing the past few months.
Thank you, Nellie, for this conversation and for tagging along for all of this.
Before you go, Drew, I know it's heavy subject matter, but I do want to ask you about a Gulf States gem. Like you said, our newsroom traveled over 5,000 miles across Mississippi the last few months, so we've been many places. I'd love to know if there's a gem that comes to mind for you.
Actually, yes, I do. I had the best pie I've ever had while we were out on the road talking to people with lived experience of addiction. We were in Dublin, which is just outside Clarksdale. We were there to meet with people at the Fairland Center. That's where we met Allison Koenig, who we heard from earlier. And after we left, I went and grabbed lunch. And I stopped at this place called the Dutch Oven. And it's a place run by Mennonites. So, the bread was amazing. But I also had a slice of lemon icebox pie. I don't even really know how to describe it. Let me just put it this way. I had a bite, and I didn't even say that was good, right? I just took a bite, and I thought, this is the best pie I've ever had. I didn't even have to think about it twice. It was with a definite, absolute certainty. I also got some brownies to bring home to the kids, which, of course, they loved. But I'd also like to get your gem as well. With all this time on the road, what comes to mind for you? What really stands out?
So when we were up in the Delta covering the Fairland Treatment Center, actually the night before I stopped by the Ground Zero Blues Club in Clarksdale. And, I couldn't head to the birthplace of the blues without actually catching some live music. And I will say Ground Zero did not disappoint. They have live music every night, paying homage to the juke joint tradition, and they get visitors from all over the world. The place is filled with flags from the international guests who make the pilgrimage to hear the blues.
All right, so both our gems come from Clarksdale then.
Yeah, they sure do. This week's show is cooked up by the Gulf States Newsroom team. Our theme music is by DJ Supreme. Special thanks to our partner stations, WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Again, I'm your host, Nellie Beckett. Thanks for listening, and don't forget to stir your room.